Hi there, how are you doing? Good, okay. So, you're here for an updated cranial nerve exam, alright? So your regular doctor has sent you here, okay? So we're going to do the full cranial nerve test, alright? And then the results will be sent straight to your doctor and he'll be able to review those in any kind of capacity that you're already speaking to him about, alright? So we're going to go through various different nerves. I'm going to be doing various different tests, okay? If at any point you feel uncomfortable or you want me to stop, then just let me know. Okay, I am just going to move through them fairly promptly, so just, feel free to just talk if you want to ask anything. Alright? Okay. So before we start, I just want to have an overall look at you just to make sure that you're not immediately injured or going to fail this test because of an obvious illness, okay? Okay, and do you currently have any illnesses or disabilities that I should be aware of? Okay. Alright, so I have given you an overall look. I feel like you are fit for the test. Are you happy for me to proceed? Okay, alright, so we're going to start with the olfactory nerve, and this nerve is responsible for your smell. Okay. Alright, so I have 5 different smells for you, okay? So they are all clear liquids, so as to not confuse you. Alright, and I'm just going to place it in front of your nose. I'll give you a chance to think. I'll do it again, and then if you could describe the smell and then tell me what you think it is. Alright, so... Okay, this is the first smell. Alright, take a couple of seconds. And I'll do it again for you. What do you think? Okay, so a very fresh smell, yep. Any guesses? Correct, yeah, this one is mint. Okay, it's the second smell. So just take a nice deep sniffs. Okay, give you a couple of seconds. Alright, here it is again. Okay, and how would you describe that smell? Floral, okay, any guesses? Yeah, this is rose, well done. Excuse me. Alright, now on to the third smell. Okay, nice deep breath. Okay, I'll give you a couple of seconds there, and then we'll try that again. Alright, could you describe that for me? Citrus, okay, could you take a guess? That's lemon, well done. for the fourth smell. And again. I'll give you a couple of seconds. Could you describe what you can smell? Okay, reminds you of summer, floral again, calming, yeah. Lavender, that's perfect, well done. Now this one is slightly more difficult, okay, so you may recognise the smell, but you might not know the name of it, which is why I do ask you to describe it instead of just telling me what it is, okay. So here's the final one. Give you a couple of seconds, and again. If you could just describe it. Okay, so slightly floral. Yep. Okay, it is a spice. Yep. And it is something you won't find in the UK. So, yep. More like Asian dishes. Yep. Can you have a guess, maybe? No, okay, that one's cardamom. All right, and you did pass that because you did describe it very well. Okay, you just didn't know the name of it, and that's fine. All right, so you scored perfectly for smell. Well done. Okay, so now we're looking at the optic nerve. All right, so I'm going to hold up this chart for you, okay. I'm going to stand a couple of steps back and I'm going to ask you to just read the letters out. Alright, I'm going to ask you which colour is brighter, okay, and then we're going to have a bit more of a detailed inspection of each eye as opposed to both of them at once, okay. So if you could just start from the top, alright, and just tell me what the letters are, okay, I will help you out. So, okay. Okay. Good. 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 Yeah. 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 Okay. Keep trying. Can you try this one? No, okay. And the green or the red? Okay, very helpful, thank you. So, I'm now going to ask you to cover one of your eyes with this tool. Okay, so this is going to block out one eye and allow you to just see with the other, and I'm going to work out if both eyes are working appropriately. Alright, so I'm going to stand a little bit closer this time so I can hold this as well. Alright, so if you could from the top, yep, 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 good, 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 and can you go right to the end? Yep, perfect. And is the green or the red more prominent? Okay, perfect. Right, going to get you to the other eye now. So start from the beginning. Yep. 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 Perfect. Perfect. And the bottom line. Okay. And is the green or the red more prominent? Perfect. Alright. Let's just check each eye with the light. Okay, and just tell me when you see the light. Okay. Okay. Perfect. And the other eye. Okay. Perfect. Perfect. And if you could just tell me how many fingers. Okay. 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 Perfect. Alright, and the other eye. Okay. Perfect. Very good. Okay, scored really well for the vision. Okay, so now I'm going to be looking at your eye movements, okay, and this will cover your ocular motor, your trochlea and your abducens nerves, okay. So do you have any issues of light sensitivity? Okay, alright, so if you could look at the light for me, I'm going to move this in different directions, and then all I'd like you to do is to just follow the light. Okay, so alright. That's great. Okay. Okay. And now some more rigid movements. Okay, I'm just going to cover one eye. Perfect. And now just covering the other eye. That's wonderful. Okay, just looking at my fingers. And just follow my finger, please. Doing really well. Just testing the strength of the eyes as I continuously do this. Wonderful, doing so well. Okay. Alright, I'm just going to have just a close look at your pupil response. Okay. So now I am going to be looking at your trigeminal nerve, okay? Alright, so I have a cotton bud and something slightly harder here, okay? I'm going to just touch you on different places of the face, okay? And I'd like you to tell me firstly whether it's soft or hard, okay? And then also if you get any pain in this region here, this is where the trigeminal nerve sits, alright? Sometimes when we touch different parts of the face, if there is damage to the trigeminal nerve, it can flicker intense pain, okay? So just let me know if anything like that happens, alright? So close your eyes, thank you. Okay. Good. Okay. Okay. Mm-hmm. Good. 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 Okay. Now I'm going to use something slightly sharper, except if you look very closely you can see it's not a needle. Okay, it's cut off at the end so it feels a little bit like a pencil. That's it. Okay, so I'm going to use this and this. Okay, so slightly harder to differentiate. Alright, just tell me whether it's needle or the stick. Okay. Okay. Mm-hmm. Okay. Mm-hmm. Okay. Yep. Good. Good. Well done. So the eye movement, sorry, did really well, and the trigeminal nerve as well. There's no issues there. Okay, so we're going to look at the facial nerve now, followed by the vestibulocochlear nerve. It's a bit of a tongue twister, that one. So with the facial nerve, it's a very simple test. Okay, I'd like you to mirror the facial expressions that I do. All right, so okay, okay, good, good. Good. Alright, and just so I know that your brain is functioning properly, I'm just going to say some expressions and I'd like you to do them. Okay, so angry, okay, surprised, okay, scared, alright, happy, alright, and just frowning for me. Okay, wonderful. So with the hearing, alright, I'm going to just do a series of different sounds. So firstly, if you could close your eyes, and I'd just like you to tell me which side you can hear the sound in. Alright. Okay. Mm-hmm. Okay. Okay. Perfect. Keep your eyes closed. Okay. 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 Good. 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 Well done. So you scored really well. Okay. Alright, so let's do your glossopharyngeal nerve and your vagus nerve. Okay. So your glossopharyngeal nerve is all about your throat and swallowing, okay? So when I do this test, all I'm going to do simply is ask you to swallow. I am going to use one of my sticks, okay, to just place into your mouth so I can see what's happening. Alright, when you do swallow, if you get any pain here or at the back of your throat, it could indicate some damage to the nerve, okay? So just open your mouth. Thank you, and swallow. Alright, and again, please swallow. Okay. Any pain at all? No, okay. Alright. Now, with the vagus nerve, I'm just going to ask you to repeat a sentence, okay? And then all I'm going to do really is listen to how well you speak, okay, and how well the mouth moves. Alright, and then I'm going to get you to make some sounds with your throat, okay? So just to begin with, please just say, "My name is," and then say your name. Okay. Alright. Okay, and just say Dr. August. Okay. Okay, perfect. Alright, now I am going to just put this stick at the back here. If you could say "ah." That is wonderful. Okay. So I'm going to take your heart rate and blood pressure. Alright, this is part of the vagus nerve, okay? Can I just ask you a couple of questions first? Alright. Are you experiencing any nausea, or have you been in the past 5 days? Okay. Any stomach issues? Any digestion problems that's out of the ordinary? Okay. That's great. All right. Let's take your blood pressure. Okay, if you could just pop your sleeve up for me. Alright, just going to put this around. Let's get some of this air out. Okay. And you're going to feel some tightness, alright? It won't be for very long. Okay. That's great. Thank you. And now I'm going to check your heart. Alright, lift up or just pull down your top. Thank you. Nice and still for me. That's great. Okay. Alright, that sounds very normal. Thank you. Okay, I'm just going to pop my gloves on. going to check your spinal nerve now, okay? So I'd just like you to look straight at me, okay? Look this way, okay? Look this way, okay? Look up and down, okay? Put your hip all the way back as far as it can go, and then bring it forward, and then all the way down as far as it can go. Great. All the way to this side. That's great. All the way to this side. That's wonderful. Okay, now I'm just going to put my hands on your shoulders and please push against them. That's great. I'm going to place my hand on the side of your head. Please push against it. That's great. And the other side. That's great. If you could put your hands out in front of you. Okay, I'm going to try and push your fingers closed. You just try and open them. That's great. I'm going to try and push your hand down. If you push up, great. And the other one. That's it, yep. That's wonderful. Okay. And now I'm going to just check your tongue movement. Okay. So if you could stick your tongue out and touch the roof of your mouth and to the left and to the right. Okay, that's brilliant, thank you. Alright, so we checked your olfactory, which was great, optic, oculomotor, trochlear and abducent, which were all great, trigeminal. Okay, I just need to do one more thing with that one. Your facial nerves, great. Vestibulocochlear, perfect. Glossopharyngeal, your vagus, spinal and your hypoglossal nerve. Okay. So, with the trigeminal nerve, I actually just wanted to touch a couple of points on the face that I know are triggers for the pain, and just let me know if you feel anything. Okay? Anything? No? Okay. Okay. Alright. Anything at all? No, okay. It's a final look. Okay, great. Okay. So I will write a report for your doctor, alright, but you can expect the result to be normal. I hope that's reassuring for you, okay, and I hope that helps in whatever diagnosis the doctor was looking for, okay. If you do suddenly experience any pain today, especially in the face anywhere, around the eyes, in the ear or at the back of the throat, please let your doctor know that that has happened, because there may be a delayed response, but I'm not worried at all, so don't worry. Alright, so apart from that, hopefully I won't have to see you again, but take care, alright, and I hope everything goes well for you. Alright, take care.